Excellent. Great. So welcome, everyone. It's really an immense pleasure to have you here and welcome you both in the room and also on Zoom to Anat Rosenthal's talk. So I suspect many of you actually already know Anat because she was based in Montreal from 2012 to 2015, first at the Institute for Health and Social Policy and then at the Center for Research and Ethics. And I think we've been extremely lucky that Anat has been staying in touch with us and regularly visits us in Montreal, pandemics permitting. So it's really a pleasure to have you back, and also feels very natural to have our old friend back in town. So Anat is a medical anthropologist and senior lecturer in the Department of Health Policy and Management at Ben-Gurion University of the Negev and the Guilford Glaser Faculty of Business and Management. Her research deals with global health policy and healthcare delivery, particularly in resource-limited settings in the developing world. She has conducted fieldwork in both Israel and Malawi on the social and cultural effects of AIDS, as well as on national and international health policy and on undocumented migration. So one of the many things I really like about Anat's work is that it helps us hear from people whose voices and perspectives are often ignored, and it helps us see the impact that political decisions have on people and their lives. So one example of this is Anat's book, Health and Delivery, the rollout of antiretroviral therapy in Malawi, which was published in 2012. Another example is a report that Anat co-authored and which has just been published by Physicians for Human Rights, entitled The Consequences of Israeli Human Rights Violations on the Health of Women in the Gaza Strip. So as you can imagine, neither of these are easy reads, but I think they reflect that Anat's sensitivity when it comes to sharing the often horrendous experiences of the people that she works with, but also her determination to make sure that we all hear these stories. So I think that's a really rare combination of talents that I've very much come to admire in Anat over the years. So I hand it over to you, and I very much look forward to hearing your reflections on the pandemic. Thank you. Welcome, Anat.
Thank you. Wow. Thank you for this incredible introduction, Kristen. I don't know if I should start talking or cry or just, skip the talk and go for drinks. It is an immense pleasure to be back here in town. I'm really touched by this invitation and humbled. It's been 4 years since my last visit. There's, maybe you've heard about it. There was a thing that happened that prevented us from moving. I'm also seeing a lot of all the new friends joining us on Zoom, and it's a real pleasure to see everyone. So thank you for this honor of just being here and talking to you and taking this opportunity to reflect and share and think together about things. And I'm just gonna start, because if I continue, I'm gonna start crying, so please. Okay, so here we go. So a few weeks into the pandemic, I received the following. So a few weeks into the pandemic, I received this. And I'm sure a lot of you did too. My first reaction was, and then I sent it to a bunch of other people as well. But then when I was done being excited and frustrated, my second reaction, and the more concerning one, was, okay, so where do we go from here? And in the last year or so, I've been thinking about what we've learned from COVID. And I started to put all these into my notes, and the very, very preliminary version of these notes were presented at the Van Jerusalem Institute in the spring of 2022. But these notes kept growing on my computer. And originally the file was called Global Health After COVID. But then in August, I got COVID again. And the penny dropped that this is not after COVID. We're not after COVID. We're sort of in between COVIDs. And the after is probably not coming. And following the tradition set by the wonderful Peter Brown, whom some of you met here at McGill a few pandemics ago, I guess, I started to think, as a medical anthropologist, like Peter has taught us, so what now? What are we going to do next? Almost 4 years into COVID-19, the dust is settling on the impact of the pandemic on global health theory and practice, and the lessons that we haven't learned from the past. So drawing from the ongoing research project, my own and other projects, and personal observations and frustrations, I have to say, I wish to reflect on how we study and understand global health between COVIDs. I'll do it through the lens of the COVID pandemic and its effect on notions of the global community, on the lessons that we haven't learned from history, and on solidarity. Many of us in public and global health jumped into COVID to do what we do. We investigate, we explore, we theorize, we practice. I admit I was part of this trend. And it's like shout out to Kristen and Ever, Nahimana. We wrote when we were angry mostly. And that's where our piece on vaccination passports came from. But obviously the pandemic affected many of us in such a profound way that it deserves more thought and more discussion. And I'm going to use my time here to speak about three things that COVID made me realize that are relevant to how we study global health in other contexts, not necessarily COVID related. And the question of now what? Community, the myth of the same boat. Thank you, Lego. So in the first months of the pandemic, common wisdom had it that for the first time in history, not true, the entire global community, also not true, was in the same boat, so not true, facing the same storm. No, I don't even start about that. Not those making the same boat arguments talked about the pandemic as the absolute leveler of the global community. But truth be told, it was never the same boat, neither was it the same storm. From the first border closing in March 2020 through the inequitable distribution of vaccines, all the way to the isolation of South Africa in November 2021, and actually the whole of the African continent, the last few years shattered what we had left of this same boat narrative. The lack of same boatness was evident not just when comparing the global south to the global north, and its expressions was evident not only between countries, but even within countries. The data coming from New York City in the spring and summer of 2020 showing the pandemic's impact on inequality and morbidity and mortality. And I don't know if you remember these, right, coming out in 2020, showing the inequities and the morbidity and mortality among different ethnic groups and different populations, the relationships between poverty, geography, and COVID infection. So they were surprising and not surprising to a lot of us that talked and thought about health inequities over the years. Whether the claim of the same boat was ideological or instrumental, and I'm going to talk about that in a little bit, the captains of the narratives of the same boat, focused on the same threat. However, even when the threat was shared, some nations and populations were deemed more deserving health than others. That moment with its glimpse of opportunity was de facto managed without an ounce of empathy or solidarity. Same boats seem to be popping up in various contexts. I have been thinking about same boats as I was watching the devastating reports from Libya last week. Medicaid Daniel devastation is now being investigated not only as a climatic event, but also in the context of the neglect to maintain the dams in Derna amidst the social, political, economic turmoil that has engulfed Libya in recent years. Climate change is another realm where same boats narratives are heard. But indeed, this is also far from the truth. Climate change is another realm where same boats narrative are being heard. In our study that is conducted in partnership with Partners in Health in Malawi, we have followed households affected by Cyclone Idai that hit in March 2019. And what we were doing is following households who were still homeless 6, 12, and 18 months after the cyclone. The study has shown that these were the households that were led by widows, older women, disabled members of the community, or parents of disabled children, and the mentally and chronically ill. While the whole region suffered the devastation of the cyclone, it was the most vulnerable in each community that were suffering the most. Little did we know at the time of Idai that Anat, the next tropical cyclone in 2022, will bring a cholera outbreak that will last over a year and well into Freddy, that storm that followed in 2023, and stretch the capacity of health services even more. But the result of this first study about Idai, which are soon to be published, led us to think more systematically about adaptation of health services to severe climate events, a topic not often addressed in low-income countries. While climate change is often presented as a global challenge and a shared threat, we are once again not in the same boat. And so more thought and effort should be put into climate mitigation and adaptation in vulnerable areas of the world with a clear intention to address and prioritize poor and vulnerable members of these communities. Thought number 2, history's lesson or our moral failure to learn from the past. In May 2020, well before the first vaccine was offered to the public, and I should know I'm Israeli, Richard Cash and Vikram Patel published an article in The Lancet in which they have said this. If COVID vaccines are developed, history suggests they are likely to be available first to the countries that can afford them to purchase them, and only then will they trickle down to low-income countries, while they will reach the wealthy first. And while there was the talk of COVAX and same boats and optimism, and it was all up in the air, the global community did not learn from past lessons, and vaccine inequity very quickly echoed the history of AIDS drugs in the early 2000s. It took years of legal struggles and activism to make generic and reduced price drugs available to people who needed them, and millions died waiting. Their lives mattered less to the global community. 20 years later, here we are. We are arguing for the reauthorization of PEPFAR, now under reconsideration by the American Congress. If you follow the debate, and I know some of you do, Republicans have found a way to connect PEPFAR to their lives. And now PEPFAR is under threat of not being reauthorized and stopping the support to HIV program across the continent. And while PEPFAR has not been perfect, and other programs have not been perfect, they have saved millions of lives and changed HIV in sub-Saharan Africa forever. From years of devastation marked by uptake of coffin production, we moved to questions of service delivery and integration of care that have improved not only the lives of people with HIV, but also the lives of people who needed care for NCDs or maternal and child health. A lot of other things got better, mostly in areas that had very, very limited healthcare systems. In recent years, we have seen an explosion of initiative providing outreach care for HIV and to other patients. But having said that, our studies in Zimbabwe and Malawi, in collaboration with the University of Zimbabwe and the Biomedical Research and Training Institute and the University of Malawi, and again, Partners in Health, have shown that people are far from achieving what is known as chronic normalcy. And life is still fraught with uncertainties. There is still a big part of people's lives when they have HIV. Or as phrased by Jonas, a clinical officer that was interviewed in one of the studies, we don't achieve what we're looking for, okay? It's in fact, we are managing out of chances. Humanity seems to be a forgetful bunch. We as global health people should advocate for a discourse that practices and acknowledges the historical perspective and the lessons we have already learned. Thought number 3, on solidarity and partnership. That being said, I did not travel across the Atlantic to, bring everyone down. So I do want to end on an optimistic note and say something about what global health can be beyond, between, and after COVID. In a recent talk by political scientist, physician, and overall awesome person, Danny Field talked about solidarity as partnership. However, when a group sponsored by the Van Leer Jerusalem Institute started to explore what solidarity in public health is, it was almost impossible to reach an agreement. And we were social scientists, legal scholars, physicians, spent a lot of time arguing over what solidarity is and should be. The disagreement prompted a bunch of us, namely Hagai Boaz and Nadav Davidovich, who is here, hi Nadav, to question whether solidarity in public health was a real thing. Soon enough, we came across the tensions around the uses of the term in global health, and I just want to share 2 examples, if I may. This is from a speech given by former WHO Director General Margaret Chan in September 2015, where she said, the Millennium Development Goal of reversing the HIV epidemic was reached ahead of the 2015 deadline, an incredible achievement that testified to the power of national action and international solidarity. But a very different way of talking about solidarity came out of Médecins Sans Frontières in 2014 in response to the Ebola outbreak, where it was said that despite the media overload, people in the front line of the Ebola response feel increasingly abandoned and isolated in their daily struggle. An epidemic of this proportion requires an immediate and massive injection of resources with presence on the ground. It needs manpower, materials, funding, and more importantly, political will and solidarity that sends people into the field in support of exhausted and drained national health staff and populations in need. As we were going through this uses of solidarities in global health literature, our next step was to try to map out how people in global health talk about solidarity. What kind of solidarities are we finding in the literature? And this is pretty much what we came up with. We can call them 3 models. And again, we're moving away from political science and political philosophy and their conversations about solidarity and looking into global health and public health. And we identified sort of 3 streams. One of them is what we called instrumental solidarity. That's a kind of solidarity where we do things for others because one day it's going to come to us, or one day we're going to need their help. And that is one trend. The second one is solidarity as a community sentiment. And this is mostly the writing, we see it a lot in anthropology, where solidarity is something that comes from the community, recognized in the community, but can leave a lot of people out if you're not part of the community. And then the third trend is what Paul Palmer called pragmatic solidarity. And this is where you stand with someone to achieve a goal. This was interesting to us, but still unsatisfying. There was something in this term solidarity that was used so often during the pandemic that bugged us. And because the 3 of us couldn't agree on what was bugging us, we decided to ask other people. And this is where a current project that is still ongoing came from. And in this project, what we decided to do is to go ask the people who are doing solidarity, what is solidarity to them? So the objective of the project is to go deep, but also go extreme. And instead of just asking people what they think solidarity is, we're asking scholars in global and public health what they think it is. We decided to approach emergency response worker, people who are doing work mostly overseas, responding to extreme situation, conflict, war, natural disasters, and ask them what they think solidarity is and how it is practiced, if at all, in their work and in their organization. So our goal was to explore various understandings, because by that point we were starting to talk about solidarities in the plural and not solidarity as one thing. So the uses of solidarities and how it informs the practices of the aid agencies, humanitarian organizations, and other health organizations that they're working with that are doing work overseas, so beyond the borders of their own communities. How is the term defined? How is it used? Is it being used? Does it have an impact on their organizations, on their own experiences? And by the way, we're still looking for people to talk to. So if you have friends or colleagues who have been involved in international work, please get us in touch with them. That's my commitment to Negev, who is home online. And this has been a very interesting experience from day one, because our first interview, the woman who we interviewed said that. So the question was, is it a term, solidarity, a term that has been used? Have you heard it echoing in the hallway? And she said something very interesting. She said, yeah, absolutely. We have a slide deck about it. It's defined in the humanitarian principle as part of humanity. In the end, it is also leaving no one behind. That's the slogan that comes with it. In the text, blah, 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 leaving no one behind. That was interview 1. That's when we knew there's going to be interview 2, 3, and 4, because this was already interesting for us as a definition of how people who do that kind of work think and talk about solidarities in their organizations. And so while Philip was talking about the nation state, when he gave his lecture on solidarity and partnership, I suggest we broaden his idea to think of global solidarity as an invitation for partnership. Not a solidarity based on the instrumental need to protect others in order to protect ourselves. That is a very, very common pandemic narrative. But one that sees others as equal partners, sharing the same world, or as one other participant in the study called it, solidarity as accompaniment, which was one of my favorite quotes, I think, from the study, probably the title of the article. Such partnership requires the building and the maintenance of trust in global institutions during routine times and during emergency. It also requires an acknowledgement of privileges and injustices, past and present, and the responsibility of those who cause them. And this goes back to the Gaza report, Kristen. And it requires the strength to do things differently, to prioritize life over profit. And between pandemic and facing climate change disaster, there is an opportunity to partner in solidarity. The global health community, especially its privileged members, us, need to commit in order to do that. I'm gonna stop here, even though I can continue for a while longer, because first of all, it's Friday afternoon. But also because I want to keep the floor open for your thoughts and questions, and also emails for people who might want to be interviewed. So I'm gonna stop here so we can have time
Yes,
for
thank
questions.
you very much. Do you want to start? You want to kick us off?
Yes. First of all, it's always an amazing pleasure to hear Anat presentation. She is the best. Indeed, first of all, I need to start with an anecdote, because you must know that at the beginning, Anat refused, because we are teaching together global health, and she refused to reflect on COVID. So we were texting today, and it's already now more than a year that she's reflecting. So Anat, I'm very happy. And you're probably wiser because you're always taking some time to take your note and reflect. I want to, I'm sorry, maybe I'm doing it not the best service or not, but I cannot escape what's going on now in Israel, and some strange feeling now with the medical community that became involved in demonstrations, and the first time there's a feeling maybe of, because solidarity can be also within the healthcare professions that suffered quite a lot and went through lots of burnout. So I want to ask you, maybe because I know that you spend lots of time also in your work, to talk not just about solidarity with the communities that you are working, but also maybe solidarity within the different healthcare professions and the different organizations, because sometimes in different places, again, I'm much more an expert in Israel and the Middle East, much less about Africa, but can you tell us a bit about solidarity that can be, because solidarity can be with different aspects here, so about this burnout and between the managerial and the rank and file that are working. So I know that you're thinking about it, and maybe you can tell us a bit about this kind of solidarity. You remember our work with the CDC and you need to die in order not to get to work. So these kind of things.
So, wow, okay, thank you, Nadav. So he is right. I was unwilling to talk about COVID for the first 2 years. I wouldn't talk about it, I wouldn't teach about it, I didn't want to be interviewed. I had to think, and I think this is the result of the thinking. So talking about solidarity and healthcare workers, I think the starting point is that I'm not sure what solidarity is. I know what it is to me, which is why I love the quote about the accompaniment, because somehow it felt like the best way to describe how I saw it. And yet it has a lot of limitations. So the first time I went back to Malawi, what we thought was after COVID, but was actually in the middle, that was October 2021. I was boosted. I had 3 shots in me. The first of them was probably way before all of you got vaccinated. And most of my health worker friends were either not vaccinated at all or had 1 shot. And I'm not a healthcare worker. I don't engage with sick people. I don't take care of people. I don't treat them. And I was vaccinated just because I'm Israeli and my government vaccinated everyone. And so I think that for me, that was sort of an invitation to think about what does it mean? And not just in terms of, oh, this is unfair, because it is, but actually what does it say about us as a global community? Where instead of saying, okay, the people who need vaccines are gonna get them, and then the people who teach from home and maybe walk their dogs twice a day, they're gonna get it at the end. Not that we're not important, but come on. And I think this for me, and Nadav knows it, that's why he's asking about it, that was sort of a starting point, to think not in terms of either rank and file or health workers in different places, but to think of health workers as a community. Because this interaction in October 21 was very interesting to me. I was embarrassed to be vaccinated. I didn't want to talk about it, but all my colleagues knew I was vaccinated because, there was an article in the New England Journal of Medicine about the vaccination program in Israel, and they were excited to hear about it. They wanted the detail. They wanted to know not only how decisions got made, because none of us know, and this goes back to Nadav's point about the political issues in Israel, but how did it actually work? Like, where did you go? How did you get your vaccine? How were you called to get vaccinated? People were very excited to talk about it. And I really didn't want to talk about it because I was ashamed that I was vaccinated. And I think this is, Nadav, part of what we're talking about. how do we manage, and I mentioned privileges and injustice, and how do we manage that both as people in the world, but also as scholars and collaborators and friends. Nadav, do I have to talk about what's going on in Israel? I don't know how many of you follow, but there are issues. There always are, but they seem to be bigger than usual. And the health community, not just the medical community, but the health community has spoken up, which I was impressed to see, because for many years there were other issues happening in the region and the medical community wasn't necessarily very active. And I think this was a very interesting development. And people seeing themselves as political actors and not just as healthcare providers was a very interesting kind of move to follow. Are they I want to believe that they're doing more than just protecting, their bubble. We're gonna have to wait and see how that continues. But this is the move from being a professional to being an activist that we're seeing in a lot of places. Is that okay, Nadav? Can I drop the Israeli part now?
I think it's amazing to see that, things that you and I and others work with Physicians for Human Rights for years, now being adopted in few days, they stopped healthcare to the Ukrainian refugees, many things that, or prisoners, things that never the healthcare profession, the majority of them were discussing, and now it's very easy to mobilize. And so that's an interesting thing. And also working together, so I stop here. Yeah, sorry.
No, I'm just saying all that is true until you say occupation. And then it gets more complicated.
Even on occupation, it's much easier to speak now, but you're right that it's a very problematic. I'm talking about the medical profession now, not Israelis in general, but also solidarity that now physicians, nurses, health workers, others working together. I never remember such. We tried to do it in the past, and now it's taking place, and it's interesting to see if it's going to continue.
Yeah, we're in the desperate time, desperate measure space, I think. Yeah, thank you, Nadav.
There's a comment in the chat from Meredith Schwartz. I can read that out, but I also want to check if Meredith would like to ask that question.
Sure. I wanted to, can you hear me?
Yes,
we can.
Okay. I wanted to thank you for the talk, and I think that it's like a great approach to ask people who are actually doing this work what they think of solidarity and how the concept of solidarity could be useful to them. But I also wanted to know, this is sort of more from the theoretical approach to solidarity, whether you've looked at the relational account of solidarity that Nuala Kenny, Susan Sherwin, and Françoise Baylis have developed, because it's an account that I don't think quite fits with the three accounts that you provided, and that also sounds a bit more like what your interviewee said to me. Mm-hmm. So it's more of a they try to say that solidarity, a problem with traditional approaches is that it takes an us and them perspective, whereas in their account they think it's an all of us together, right? So when you were saying, protect them so that we're protected, it's an us and them type thing, and the account of solidarity that they're trying to develop is more of a all of us.
Yeah. So what was interesting at least interesting to me, Chagai and Nadav can answer for themselves. What was interesting to me is how in different organizations there are different ways of understanding solidarity, and how the culture of the organization affects the way the organization and the way the people working for the organization understand what solidarity is. So not surprisingly, the amazing interviewee 01 works for a big organization that has slide decks. Like they have a mission, and it's a stated mission, and it's organized, and you have training when you start working. People working for small organizations had different narratives. An interviewee who's been doing humanitarian work for many years, her first reaction was, oh, I never thought about solidarity as something we do. Even though she worked for many years in conflict zones and has a lot of experience being with people, not necessarily in a them versus us situation, but her account of what solidarity is was completely different, and she hardly ever used the word. So I think at least for me, this was not just about finding one definition. I'm not sure there is. It is more about understanding how different actors within the world of global health, humanitarianism, see what solidarity is and see what we can learn from it in terms of how it's being used. But thank you, that's a great comment.
So I have a question, just sort of hesitating to ask because it's a bit, well, you know me, it's not going to be like an optimistic outlook. So you said towards the end, you were starting to outline this idea of global solidarity as partnership and the importance of working together as equal partners. And I guess in my mind, to me, the COVID experience is just, you're emphasizing this, the amount of inequality that's come to the surface and also the unwillingness, even within countries, to show solidarity towards people who might be at greater risk or who might be, for various reasons, be at greater risk. And globally, obviously, it was, whatever the opposite of solidarity is, complete absence of solidarity. So in a context of such vast inequality, certainly globally, but also within countries, where does that idea of solidarity go? I mean, can it even get off the ground if in a context that is so unequal and continues to be so unequal?
So as you know, I'm not an optimist either. The only optimist in our household is the dog. She's thinking that if she walked into the kitchen, she's gonna get food. I think for me, and again, this is a very personal experience, right? People experience COVID in different ways. It also had something to do with what you did while you were COVIDing. One thing, and you mentioned it, so I'm going to say it, but one thing I did when we were COVIDing or right after was join the board of Physicians for Human Rights Israel. Was a volunteer for many years and then joined the board. And in a way, being exposed to so many things at the same time opened my eyes, among other things, to my privileges. And I think this is a starting point. So acknowledging your privileges and be okay with letting go of some of them in favor of others. I think for me, that was a big lesson in COVID. And it came up, so there was I don't know if it was the same initiative in other countries, but there was an initiative in Israel that for any vaccine you bought a vaccine for someone in a different country. Did they do that in Canada? So apparently a lot of Israelis felt guilty for getting vaccinated so quickly and so efficiently. And so there was this initiative, which on the one hand was, fucking ridiculous, but it helped people think about their privileges. And I thought that's actually a great student project. We need to interview people about that. But that was a very interesting conversation to have with people who chose to donate, basically donate the equivalent of the shot that they got to organizations in other countries that were collecting money to vaccinate people. And that is, once again, not an optimist, never will be, but I think that's a very interesting kind of departure point to think about where, and obviously not all the people on Zoom and here, we're not all in the same place. I'm not gonna argue that. But for me, that was an interesting experiment with myself and then with people around me to acknowledge my privileges and then to see how I can use them to do good and to try to fix some of the injustice that I was seeing around me.
So sorry, how did it work with the shot that you were sponsoring for someone else? Do you have to pay for that? Or?
Yes, so you donated the sort of equivalent amount of how much it's gonna cost to vaccinate somewhere else.
But that doesn't help when there's just a vaccine shortage. So I'm just trying to
it depends, right? So in some places there was a shortage, in some places it's just a matter of not having money to buy it. Mm-hmm. Yeah, it doesn't help with the shortage, that's true.
Okay,
we didn't fix it, we were thinking about it.
Yeah, but interesting stuff, but I hadn't heard of that. Yeah. Okay, so I see Madhupai, you've got your hand up.
Yes, hi Anat, thank you for the wonderful talk. I fully agree with the first two myths. In Canada here, we were probably not as fortunate as Israel, but among the most privileged in the world. Our kids were getting boosted here before many parts of the world could even get their first dose. And we had very similar conversations here as well. I and many others, we tried very, very hard to convince the Canadian government to do the right thing. That is, donate the vaccines, back the TRIPS IP waiver as a School of Population and Global Health. With Tim's support, we wrote letters, we did signature campaigns, we met with MPs, I spoke at the Canadian Parliament. We did everything possible and nothing worked. At the end of the day, Canada did massively fail on being good allies and showing solidarity. And we wrote a whole paper in BMJ dissecting Canada's response. And one of the chapters is how we failed on vaccine equity. I think while we can approach solidarity and we should approach solidarity as individual, what can Anat do? What can Madhu do for low and middle income countries or with marginalized communities? I believe we should not ignore or not hold our leaders accountable for their solidarity failures. Solidarity needs to happen at the highest level. If the Canadian government doesn't do what it needs to do, then no amount of work from you or me to donate our vaccine or give a little bit of money here and there, it's not even a drop in the ocean. And that's when you realize the minute you become political in this analysis, solidarity will never work out in the current political structures. I invite politicians to now come speak in my global health class. Last year, we had an MP come from Ottawa. Here's what she told me. She said, politicians always care about the next election, their voting base. If my riding is Montreal West, that is all I care about. They are the ones who want to vote for me. I don't care about vaccination coverage in Rwanda. They're not voting for me. Number 3, all short-term gains, right? What's happening right now in the polls is what drives me and will motivate me. Populism, staying in power at all cost, even if it means doing the wrong thing. And then lastly, they cannot look beyond who funded them, right? If it's a gun lobby, they will never go against the gun lobby. If it's the big pharma, they'll never back the TRIPS IP waiver. And that's why at an individual level, we can do whatever we want. But if our government is not even giving a visa for Africans to come for an AIDS conference in Montreal, how on earth do we show solidarity? So I think the battle starts within Israel, within Canada, to do the right thing at the leadership level, because that's how we're going to get the biggest changes done. We should convince Canada to do reparations to the global south for climate crisis. We should convince Canada to do the right thing on TRIPS IP waiver. That is where our advocacy as Canadians or Israelites really comes in. So solidarity, I don't believe can be solved at the individual level. Thank you.
Thank you, Madhu. I could not agree more. If I was understood as someone advocating for individual solidarity, that was not my point. I think we need to be political actors. And not only because I spend a lot of my time demonstrating these days, but I think we have the obligation to be political actors. And I think we need to hold our leaders accountable, even when it seems impossible. This is definitely part of my job as an academic. I also think we need to educate. And this is sort of an individual, but also a community thing. Just last year, at the beginning of the year, I am asked to do a lecture for the 6th-year medical students in Israel. And it's always an interesting experience to me because I don't really get to interact with them until they're almost out the door. In Israel, it's a 6-year school. And I was giving, global health institution, global health history kind of talk. And then one of the students, who is like 5 seconds from being a physician, asked me, why should I care about patients who are not my own patients? And my head was like, what's the point? And I think this is also my role as an individual, but also our role as a community to educate, to make sure that young people at least have the opportunity to see the world in a different way. Poor guy, he got the whole speech. And then by the end of the speech, somehow was accused of being a terror supporter. So it really went the wrong way. But I was invited again this year, which is weird and interesting. But I absolutely agree that we need to hold our institutions accountable. We are also, and this is something we forget, we're also voters. So they work for us, not the other way around. And our guy has been hopping all over North America, kind of forgetting who's paying his salary. You see, this is how I'm going to get fired at the end. And so I think we do need to be political. I think we need to be citizens. I think we need to use our privileges as individual and as groups to change the world. I absolutely agree, Madhu. And I think I can't even imagine, having an HIV conference here in Montreal with so many people not being allowed in the country. Some of them my friends, by the way, who were shocked that they're the ones who are doing HIV work in the world today, and they were unable to come to Montreal. I come from a country who doesn't take responsibility for anything, pretty much. And Madhu, you said something about Canada and vaccines. Negev, who's here with us, was involved in an initiative to move vaccines to Palestine, which is, across the border, not even a border, one epidemiological unit. Even that wasn't obvious as our epi people think it should be. So definitely, this should be at all levels. But it also starts with people, although people cannot do it alone. Yeah. I will get fired at the end.
George Weiss is next.
Hello, George.
Hi, Anat. It's good to see you.
It's good to see you too.
Anat, I'd like to step back a little bit and ask you why you chose the term solidarity for your study and as a rallying cry, really, for activism. I've been doing a little bit of work on the semantics of global health, and the word that keeps coming up actually is equity, which means a lot of the same things. Why solidarity rather than equity for this project?
So I think it came from different directions at the same time. Part of it was the fact that the group we were part of was a group focused on solidarity, and that brought us together. A lot of us started thinking more about, some of us have been thinking about solidarity. Negev, Chagai, so the team, our team that works on this project, did a previous project on polio vaccines. Actually, when I was here at McGill, there was a mini outbreak in Israel, and whole hell broke loose. And it was interesting because it was a silent epidemic. So there was polio in the sewage. There were no cases, but people were being asked to get vaccinated. And there was this whole conversation about, why should I get vaccinated? No one is sick. Why should I get vaccinated? I'm healthy. So we started thinking about solidarity in that context. And it's been an ongoing conversation, but solidarity came popping up during the pandemic. A lot of conversations about solidarity used in very different ways. And I think for us, it was a trigger. And maybe there are other words that could be used, but for us, this was an interesting terminology to investigate.
Thank you.
Thank you, George.
Can I say something on that, Anat?
I think you have to now. He's also the director of the School of Public Health, so if I do get fired.
Oh, yeah.
Yes.
George, it's a great question, of course, but of course, we are not trying to say solidarity is a very loaded term. We just saw that it's being used many times, and it was clear for us that different actors are using it in a very different way. And even sometimes the use of solidarity can even justify racism. Of course, we're using also equity and promoting equity, but we just saw that solidarity appeared in many times. On a personal level, when I was teaching, for example, in the US, and using the term solidarity, it was clear that students felt very uncomfortable. They maybe wanted to speak about social justice. So we became interested with solidarity, and Anat, Chagai, and I also had a previous paper about the use of solidarity during the polio outbreak we had about now, it's unbelievable, but almost 10 years ago. Yep. And since then we became very interested to see how it's popping up in public discourse, medical and public health discourse, but it was clear that the term being used in very different ways. I think those who are using equity, and of course we are using it in maybe also not just in our research, but sometimes as part of being activists, etc. Maybe there was less of disagreement, although equity is also very loaded.
It's pretty.
It deserves its own, and it will be the next stage, maybe. But Anat, you are working on idioms of social mobilization, so maybe you can say something about that. It's not just solidarity.
Yeah. Well, I think what Negev is alluding to is my hate of buzzwords. And how I end up writing about buzzwords and how they're being used. Coming from the HIV world, responsibility, capacity building, and what is participation, all these other words that have been used. So solidarity is sometimes one of them, that's true. I also think it's interesting to end that Chagai Boaz comes from the world of organ transplantation, so that's the focus of his work. So he's also interested in solidarity from that perspective. Who donates organs, why, and to whom? Just a whole other conversation.
So there's a question from Tim Evans on the chat, but Tim, would you like me to read it out, or since you're here, would you like to ask your question yourself?
Yeah, sure. So thanks for your really interesting talk. Sorry, I put the question in the chat, and I'm moving, but basically, I'm intrigued a little bit along the lines of moving beyond solidarity as a sort of an individual action, i.e., I'm in solidarity with an individual, like an emergency worker, to system solidarity and the whole emergence of insurance and health, which was really not simply to make sure everybody had access to care, but to recognize that some people had greater needs, and that by pooling resources, you could accommodate those greater needs in a form of risk pooling. And I'm just wondering what you think about, you mentioned the Republicans being responsible for antiretroviral treatment in many countries that are PEPFAR supported. But, we're 20 years into PEPFAR, and we still really don't have any solidarity financing systems in many of the countries where PEPFAR works. And so I'm just wondering, on two levels, shouldn't we be advocating more vigorously for some form of system solidarity in the countries of greatest need and moving away from charity? And second, is there a role for global systems solidarity and potentially with some form of public insurance for crises? So just two questions. Thanks.
Thank you. Wow, great questions. I need to think. Well, being an anthropologist, when you talk about pulling risks and responsibilities, I think about the cultural understanding behind who's responsible for health. And I think this is very interesting when you study the ideology behind healthcare system. I come from a country where until now, hopefully into the future, we're all responsible for each other. So if you do service in Israel, people still believe in the public healthcare system, which is amazing. And that health is everyone's problem and the government's problem, even though the system is being privatized, like, the salami system is just slowly being privatized. People still, as a whole, the public believes that this is a responsibility of the state. This is not necessarily the same thing in other places. So this is one way of thinking. That's kind of the anthropological way of thinking it. But on a system level, obviously, this is where I see us wanting to move in that direction. Unfortunately, I don't see how it's happening with the direction the world is taking now. And Tim, you mentioned the history of PEPFAR, which I think is fascinating. And if you haven't read anything about it, go read. That's one of the craziest stories of how things happen. How do you get a Republican president and like a rock star, and pretty much the CIA bringing medications into Africa with Christian fundamentalists. So an interesting moment in time that would probably not happen again now. And I think that's part of it too. While PEPFAR has saved millions of lives, and I know Team knows a lot of these individuals, and so do I, and a lot of people in this room, it is not I hate that word, speaking of buzzword, sustainable system. So yeah, we do need to move away from charity. How do we do it? I'm not sure one person would know. I think we need some of our great minds to start thinking about it. And what is upsetting to me, and I think to a lot of other people, is that COVID was an example of how even when we have mechanisms, we don't use them. We had international health regulations. We were supposed to work together, we were supposed to coordinate. Most countries didn't. Even within the European Union, there was no coordination. And for a lot of us, it was heartbreaking because the mechanisms were in place and governments decided not to use them. And this what worries me when we talk about, system solidarity, when we talk about mechanisms. What do we do with these mechanisms when, shit hits the fan and we don't use them? And this is my concern with thinking about system solidarity, is how do we make sure that the system actually work the way we plan them to work when things happen. So once again, Kristen, not optimistic. Yeah. But happy to be in a room with people, like-minded people who are trying to think of solutions. That's the upside of it. And also being in Montreal. And I heard there's drinking involved. Yes.
Oh yeah, I guess, well, I suppose I'm wondering, going from there, do you see there being, when kind of any next pandemic that comes maybe is as much of a shock as when COVID first kind of came to the world stage? Do you see there being any big differences so far in how it's managed, how it's treated? Like, have we learned lessons? Or does it look like not much has changed?
Wow. I think there's an opportunity for change. I think a lot of what we could have done during COVID, we could have done during HIV years ago, and we didn't. And I'm not talking about individuals, I'm talking about institutions. We know those lessons. There was a first week of the pandemic, I heard a lecture, and someone talked about how our problem with infectious diseases is that for the first time in history, there was a lot of first time in history, right? For the first time in history, we understand that our relationship with other people is complicated because we're afraid of them, but we also need them. It's like, oh, this is not the first time. We have writings from the 14th century plague talking about it. This is not the first time. You've known it for centuries. We keep relearning the same lessons. Have we changed our institutions in the last 4 years? Obviously not. Can we change them? We should try. Do I know how to change them? Following up on Team Evans, I'm not sure. We're making attempts. And I do have to say that we're getting better at these attempts. And some of the things that we are complaining about now were unheard of 20 years ago. When I'm old, I started doing fieldwork as a student almost 20 years ago. When you were doing HIV work in the early 2000s in sub-Saharan Africa, you went to funerals all the time. That's what you did. You went to funerals. I don't do that as often now. Not because, I don't go, but because there are less funerals around me. And I think that's when you think not just about the individual level, but when you think about what it does to communities, to families, to nations, to the region, that is huge. And we couldn't even imagine it 20 years ago, how this is going to get resolved. So I do think that it's not all bad. I don't think we're sort of stepping in place, but I think we have a lot of work to do. And we need more brains, and we need more action, and we need to get political. I know health people don't like being political, but we have to be political. There's no other way.
So I want to okay, Gabby, yeah.
I have a very half-formed question comment, so bear with me. But
Go crazy.
I missed the beginning, so feel free to cut me off and say I've already covered this.
But you've heard me speak so many times. You're good.
I thought it was so interesting bringing up where solidarity is positioned at the individual level versus at the institutional level and what the relationship is. And I hear this talk of activism, but I'm curious whether the individual understanding of what solidarity is and the values that shape that understanding, how much they play a role in the ability to become an activist. So I'm wondering if from a collectivist perspective, your relationship with what solidarity means and your participation in it is very different than in a society that is quite individualistic and is motivated by different relationships to privilege. And I'm also curious, in Israel, would people have donated a vaccine and foregone one for themselves?
So that's an interesting, I'm gonna start with the sort of easy one, the last one. That's an interesting question that wasn't really an option because that's something some of us try to understand. Like these vaccines were not going anywhere else. So you can take them or you cannot take them, but they were not going anywhere else. So might as well take it.
No, but more in a theoretical
That's
kind
like,
of.
yeah, that's an interesting question. I don't know. I think some people would and some people wouldn't, and I don't know. I have no answer. And hopefully, you know, there's not going to be a take two of this whole thing. So we're not gonna get. I hope we're not gonna get another chance, but probably will. I do think that our culture, not just an individual, but the place we come from, will to some extent shape or dictate how we're going to see even our ability to be active, right? This is part of what we wanted to do this study because we were very curious to know if people from different cultures, different societies, different countries, working in different contexts, in different organizations, shift the way they see solidarity, which is why we opted for people who work outside of their home countries, because that does make a difference. Working within your community and working somewhere else is different. And a lot of the collective action is often in your own community. So it was interesting to talk to people who move away from their own community, who sometimes get judged because, you know, charity starts at home and you're supposed to work within your community and not somewhere else. And it was interesting to, once again, we're kind of halfway through, but it was interesting to see how if people address that. If people said something about, I'm being criticized in my community, or I grew up to believe that solidarity is something you do at home, charity starts at home, that's where you're supposed to work, and then I decided to go somewhere else, and why I decided to do that. My organization advocates for people to go beyond their borders or to stay at home. So these different understanding. My hypothesis when we started is that we're going to get a lot of stories of solidarities, not just one. And that we're going to get people talking about how their understandings changed or why they don't believe in solidarity, for example, and they have other motives for doing what they do. I don't know. Maybe one day we can come back and talk about the results. That'll be interesting too. And also an excuse, yeah, an excuse to come back. But thank you. Oh, and the other question.
Well, I guess that for me, it was like, if the individual does not have that relationship of seeing solidarity as a motivating factor for engaging with the world, how do you get them to then participate in changing the institutions?
You know what?
Or
it doesn't have to be solidarity. Just go out and vote. Hold your politicians accountable. Don't call it solidarity, but do something. And I think this is where
maybe, and I thought of this when you were speaking, and I'm sorry, I'm talking a lot, I apologize for that. But I thought about how you said some of your interviewees had an organization that put solidarity forward as a mission. And so I'll be curious to know when you have your findings, whether action reflects that mission more so than in organizations where it doesn't exist. And therefore, we as individuals don't have to do that activism if we plant the right people in the institutions already.
And I think what's also interesting is that some of these organizations that have solidarity in the slide deck actually do things that I wouldn't consider solidarity. Right. And that's also, so for some organizations, it's instrumental. It's a buzzword. It's something you use, but not necessarily something you do. So I think we're getting different kind of stories, different narratives that go into it. Yeah. It's good to see.
So I have another question. So one thing I'm wondering about, you can correct me if I get that wrong, but I wonder if, in addition to solidarity, which I think is sort of kind of motivational thing and reflects kind of a willingness to contribute to something or engage with other people's needs, let's say, I wonder if we need to supplement that with a sort of willingness to also be prepared to accept that they might have a different understanding of the hierarchy of the needs that they're dealing with. So one thing I remember being quite struck with was when I think it was Pakistan said, everyone else going into lockdown, that's just not what we're doing because it's just not right, given the situation that we're in. And And so I guess there was also a lot of discussion about how big of a problem COVID was going to be in countries that are dealing with all sorts of other health issues, different age profiles, that, where if solidarity means we're going to help you deal with COVID when actually they're much more pressing issues in those countries, is just not the right way to go. And I was just wondering if, or if the idea of solidarity can sort of integrate a willingness to say, oh, actually that's not your biggest problem. Okay, this is, so we're not going to impose our understanding of which problems are the most urgent.
Absolutely. I think COVID, for me, COVID is just a lens of thinking about things, was an opportunity. When we did the EDI study that I mentioned, more and more people in rural community, it was, I don't know if you remember the picture, we were all masked up. It was during COVID. And we would show up in households in the village and we would mask up, and out of respect to participants, we would bring masks. And they was like, oh yeah, of course, I'm gonna put it on. And when we talked about the cyclone, we talked about their families and their households and their animals, and their gardens, their farms. And then we asked people about COVID because, COVID. And people kept saying, no, this is this is maybe a problem for people in other countries, in South Africa, or in the cities. But here, there's no COVID, not really. And we have other issues that we have to deal with. And I think this for us was a lesson. It's like their priorities are not COVID. Yes, there was COVID. Yes, it was a concern, but that was not the biggest concern people have was feeding their children. It was way more urgent than maybe COVID someday, today, tomorrow. And I think this is a very good point. My priorities are not other people's priorities. Accompaniment doesn't mean that I'm going to impose my priorities on someone else. It means that I'm going to be there for someone for their priorities. Again, not necessarily as an individual member, but as a community, or in terms of political will and political action. Along the same lines that you mentioned, there were no lockdowns in Malawi. The borders were shut, but when the government wanted to impose a lockdown, civil society organization petitioned the Supreme Court and said that people are going to starve to death if there's a lockdown. And there was never a lockdown. So there were limitations on schools, on movements, on airports, but there was never a lockdown. We were under, I know you too, in Montreal, we were under insane lockdowns for a very long time. But most of us could handle it. And there were support systems that allowed us to handle it. But if you are a farmer, if you're a day laborer, there's no way you can feed your family and be under lockdown. And I think that was also a good point to remember.
Yep.
Thank you so much, Anna. It was so interesting. It's so good to see you and to hear you in person. It's wonderful. I just want to go back to, I think, I'm not quite sure, it was a George Weiss, maybe, who said, who evoked the example of American students being shocked by the term of solidarity.
Yeah.
It was, I'm sorry, it was the dot, who was telling us about the reaction of American students to the word solidarity, because I inferred that they would prefer talking about social justice. And someone else talked about charity as well. So I was just wondering, when you interview these international responders or humanitarian workers, healthcare professionals working outside their own country, so this means that they're not working in a realm, as would Rawls put it, of a basic structure within a domestic government. So it's a lawless international sphere. They're working with NGOs and not with states and not with governments. And I was just wondering, so, could there be, so for them, is solidarity better than equity? Because in some sense, equity might hint to an ideal of justice, whereas solidarity is often understood as some kind of good Samaritan obligation in the realm of charity, above the cut line of what is required by justice. So I was just wondering, do you have some sense of, do they mean social justice? Do they mean something that comes out of goodwill?
So that's an interesting way of looking at it. So we interviewed, or we hope to interview, kind of a bit of a balanced group of humanitarian workers, aid people work in aid agencies, and basically UN agencies. So they work under different systems. And some of them, you know, the international NGOs, the humanitarian organizations, they're a little bit outside of the law because they often work in circumstances where things are broken and they come there for the emergency and then they leave. And what was interesting for me in that context is to understand their motivations. How do they see their relationships to other people? And especially those who work in extreme circumstances, whether it's, you know, it could be UN agencies or humanitarian organizations, what makes you leave your house and put yourself at risk when you don't have to be at risk? And I think that sense of motivation was very interesting to me. And it's interesting because I'm sort of thinking about the interviews and just conversations I had with people about this project. A lot of them, some people didn't talk, even in the interview, I told you, there was one humanitarian aid worker who didn't think about solidarity at all. But she talked about working with people. She kept saying about working with people, and it's an organization that is mostly local staff. They have international, but there's a lot of local staff. And she kept talking about the meaning of working with people, of being there for people, which I thought was very interesting. So I think what's again interesting to me are, and this is where the team on the study differs. I think some of us are looking for a definition, where I'm interested in the different an anthropologist, in the different I don't care, I don't need one definition. I want to understand how people see it and how they experience and what the motivations are. So these are very different perspectives on it. What this thing is. I'm not even sure, to tell you the truth, that there is a thing, that it exists. It's just a label that we put on a sentiment maybe, or a motivation, and then we try to understand what it is.
Super interesting. Can I have a very short follow-up? So a couple of examples of how solidarity, what it can mean in different contexts. So for instance, when the Romano report here in Canada, because you were also speaking of how in Israel, Israeli citizens will, they actually consider their health system as a system of unquestionable solidarity between fellow citizens, or maybe not?
No, I'm just going to cut you off to say something very interesting. The language of the Israeli national health insurance law states that this law will be based on, Nadav, help me, justice, right? Justice, equality, and mutual assistance. Shivyon tzedek ve'ezra adadit. It's in the language of the law.
Well, so the Romano report in Canada was published in 2002, and this was shortly followed by the Senator Kirby report, and it was in the context of the crisis between the public health system, or should we privatize a bit partially our healthcare system? And the Romano report was a pan-Canadian kind of we're experts in commissions and things like that. So at the end, the title was Guided by Our Values, and among the values was, of course, Canadian citizens absolutely believe in their healthcare system because we are guided by the value of solidarity.
It's in the language
Well,
of the
it's
report.
it's in the language. It's very, I think, kind of it resembles what you just described. However, in other contexts, again, now I kind of missed the other example, but solidarity in other contexts obviously doesn't mean that. It's not quite social justice. It's something embedded in some kind of ethics of disaster. You think about solidarity when it's really something extraordinary that the social institutions of justice cannot deliver. So you go in and you are motivated to help others because we lack the means of helping them otherwise. So that's another meaning, very often used in the context of humanitarian crisis. And is this film permanently lived on YouTube? This Zoom recording?
After being edited.
Okay.
And fun.
Yeah. So I won't be naming no one, but I was part of a group of we were a group of global health justice, right? So there was a strong bias, a normative orientation in our work because it was always already called global health justice.
Yeah.
And we, in one of our closed seminar, this was in the context of COVID, so everything was on Zoom, it was not publicized, and people, because some of the members already had ties with the WHO, eventually we got some of the officials of the WHO having this kind of private consultation with us. And then I won't name the person, but the person was telling us what the person was campaigning at the very beginning of the vaccine equity campaign, some would say slogan, but I think that Dr. Tedros truly believed that he could perhaps help with this language and this discourse. So they were at the very beginning and they were wondering, is it vaccine equity? Is it vaccine solidarity? It was very, very interesting, the kind of a conversation we had. At the end of the day, I think that vaccine equity kind of they were trying to capture that it was something in the realm of justice rather than a humanitarian crisis. And the concept of equity is also perhaps a bit more permanent in the sense that, well, anyway, and this official actually told us that he decided not to get vaccine. These were in the very early days where some of us could finally have access to those COVID vaccines. And he decided not to get vaccinated because he knew that the rest of the world wouldn't have access to the vaccine before years ahead. So I don't know at this point if he did finally get the vaccine, but I thought that was also a very telling personal example of how, so they decided to go with vaccine equity, but his personal example was perhaps an example of solidarity.
It's interesting, you're telling that story, and I'm thinking of Zaki Ahmed in South Africa. And so he was an HIV activist, an AIDS activist in South Africa. And he was affluent enough to get treatment. And he came out and said, I'm not going to take my meds until everyone else does, which was pretty incredible, but also made a difference. And it's like lessons of history. Sort of, I see it echoing. Like, how do you create change? Can individual create change? Do you have to be in a specific position? This colleague of yours, while I respect what he did, and I think it's inspiring, did it change the global environment? I'm not sure. If more of us had done it, I don't know, maybe. I'm not sure. That's an interesting way to think about it. It also goes back to Madhu's observation about collective action and individual action. How do we make a difference? And while I'm a true believer in revolution, I really am, and I think we need collective action, and I think we need big, massive changes in our systems, it is individuals who are going to push for them. And I think it starts from us individuals coming together and making a difference, changing the world, protesting, sitting in policy groups, going to meetings, writing reports, volunteering, taking risks, acknowledging our privileges, letting go of some of our privileges in order for someone else to get theirs. But yeah, it's going to have to be collective action at the end. It's just individuals, that's not enough. Maybe many individuals could make a difference, but not just one. But it is an admirable action, I have to say.
Well, he was working on both fronts, right? He was a very important actor of the WHO. They finally got the language of vaccine equity. Maybe it was a failure, but it was an important step, I think, and on the personal side of the story, he felt.
I understand that. And now I feel a little less of a person for getting my own, but it sucked.
I have 6 vaccines.
It really did. It really sucked knowing that I got mine well before. Well, I guess most of you.
Well, I mean, most of us.
Yeah, right. And most of everything from a government I did not support it, did not believe in it, was very angry about how it was operating at the time. But when I got prompted to go get mine, I went. Which was a very interesting experience for health systems people, but that's a completely different lecture. But it was interesting because going through that experience, it was very meaningful to my friends in Malawi who were dying to know how it actually worked. So, yeah, we're in a complicated position, I find often.
Yeah, you're talking about privilege.
Hey,
And
I am privileged.
I am too, and if our malaise is the price to pay, it's not a very heavy price.
Not at all. No.
Any more comments, questions on Zoom or in the room? No? Okay, I think we'll thank Anat again very much for coming. We're organizing little 5 sets for Anat at Universel on Peel Street, so you're very welcome to join us there. Want to continue the conversation or just want to have a drink? Thank you so much, Anat.
Thank you.
I'm sorry, I didn't give you a laptop back, but I realized that that's no, I do a name's chat. I wrongly assumed like we should just go up and start using it.
Hold on.
I didn't do that. Sorry, I should have. Next time I'll know. Thank you for helping. No. Sorry about that. Thank you for.
Hey, Nick. Hi, how are you?
Long time no see.
Long time no see.
How are you doing?
Fine, how about you? Good. Having a good intro.